Right now, for those at home, we are going to do a breakout session. So we see on your screen is a group, three groups, going through a discussion session where we would discuss relevant things that you go through at home. So hang in there. We will be concluding these sessions in about 10 minutes, where we will have each group present what they are concluding. So you can see the activities going on in each of the three groups and what they are discussing. So the group of responsibility and decision making, and then the group with the communication, and this is the group with routines. So pretty soon we'll present with the conclusions for each discussion. So hang in there. I hope you're enjoying this event, and pretty soon we'll resume in 10 minutes. So here I have Dr. Keynes. Are you having a good time?
I'm having a great time. Dr. Salinas, you and your gang, I think, have done a super job. Hopefully everyone out there is learning a lot. Are they able to participate in the groups somehow? Or?
So if you are connected with Skype, you can certainly participate in the group discussions, and we have avatars here on site. They can be your legs and arms and voice here. So yes, you can participate. You just have to connect and participate in the group session. But for now, if you only have the YouTube option, you go to your bottom left on your screen and you can type in a question or a discussion point, and we can have you participate that way. So what do you think of the talk so far, Dr. King?
Well, first of all, this is a really important issue. And I think, as Dr. Salinas pointed out, as doctors, we prescribe things and we think everybody's doing them 100% of the time, and it's clear that they're not, and it's clear that there are barriers. And I think, fortunately, we've moved to the point now to start to try and understand these barriers, try to figure out ways to help people to do a better job. And this conference, I think, is a great start to increasing awareness about that, and hopefully having people start to think about how these concepts affect their own lives, and hopefully ways that they can improve things. And of course, from the doctor's end, and I realize we always sound the same and we're always boring, we say that the more you do treatments, the better your outcome is going to be. But life is complicated, and I think we need to be somewhat realistic and find ways to help you do that rather than just nag at you to do it.
Were you surprised with the data of the variation in medication possession rate? So I presented that on average, patients are refilling their medications from 20 to 72%. I was the one who reviewed the literature and what's available in the literature, and I was extremely surprised, because as a doctor, when we prescribe something, we just assume that all the patients will take the medications exactly the way we wrote in the prescription and refill the medications when they run out. And when you look at a 20% ratio, it was pretty striking to look at this number. Did you have a notion that this was the reality for your patients?
Yeah, that's an excellent question. I guess I probably would have predicted that maybe people took their medicines 60 or 75% of the time, but not 20%. The other thing that I would have predicted is that the more time-consuming, difficult treatments were the things that would have had lower compliance. And your data really didn't entirely show that was the case. I mean, even azithromycin, which seems like about as simple as it can get, didn't have a very high rate. Obviously there's some things families can do. There's some things, I think, lessons for us as healthcare professionals that we can do in terms of trying to at least increase the education part, inquire about that, and actually help families with some problem solving about how they might try to do things. And I know, for example, some of the things I will do on my CF patients with numerous medications. I have a number of my kids take their albuterol by an HFA, for example, if they just can't get all the treatments in prior to school. It may not be ideally quite as good, but it's probably good enough for most patients, certainly better than not doing it at all. So We can help work on technical ends. Obviously, there are other issues that we have a full team that social workers can help with, maybe dietitians can help with, nutritional aspects. Our respiratory therapists can help with treatments and so on. But it's a problem.
So 1 year ago, we started the CF clinic model, and we added a pharmacist to track with more accuracy how well the patients knew about their medications, and just the education component we added, and it was and it's at some points for me like an unfortunate surprise how little actually they knew. But the fact that we have a pharmacist as part of the CF team, I think a message for everybody connected, and everybody can maybe relate to this, is that it is just to have the knowledge of how much they don't understand of what you say. It's a first step. I think a second step in terms of a CF center, it is to actually have access to medication possession ratio, like see actually how often they are accessing the medication will be extremely helpful. And then I think as a third step, not just to know of and have the data more accurate in terms of how many refills, it's actually interventions. So it would be great to be part of a multi-center trial, or have one here for our own center in terms of quality improvement, and having this as a goal, raise from the range of the 20 to 70%, accessing the performance of our own patients, and have a goal of increase, I think. But having a pharmacist as the part of the CF team member is a very good start.
I kind of feel like the Today Show here. I'm online, okay. So,
People connected from Brazil.
From Brazil, wow, well, welcome. We're excited to have you join us. The pharmacist is interesting because I have to tell you, when the idea first came up of having a pharmacist join our interdisciplinary team in our CF clinic, I was not at all sure what that pharmacist was going to do. That was my first reaction. But I think what I've learned is a tremendous amount. One, I think they have helped us to some extent with an assessment of how adherent some families are. Simply because they ask the questions. And we don't always ask the questions kind of in the same way. I think their ability to educate families about what the medicines do and why they're important is very helpful. And I know I try to do that when I think about it, or if a family asks a question about it. But, in all honesty, I think I've assumed that they pretty much know what these medicines do. And that probably is unfair because it takes medical students and residents a long time to learn what the medicines do. The third thing that I think is really helpful, and I know that this year the pharmacists just started to do that, is to help families with an appropriate schedule of medicine, so we're not giving medicines back to back that counteract each other. And to be honest with you, pharmacists know that stuff a lot more than we as physicians do. And I was a little bit surprised to learn that some medicines really shouldn't be given at the same time. So I think our pharmacists have helped us in that area as well. So I'm really pleased that they're here. But I think, we still have a lot of the barriers that you pointed out in your talk, Danieli, and that was pointed out in the play, and, in terms that probably we need to pay more attention to in terms of trying to help families succeed. And I think I would focus on the attitude of, you're not a bad family if you didn't do the treatment, but how can we, in the midst of complex lives, adolescents nowadays, God, they do so many things, so many after-school activities, soccer, this, whatever, keeping up with social networking compared to when I was a kid. So how do you make this work? And I know you addressed that in your talk considerably, but I think it's going to come down to us, healthcare professionals, paying attention to it, individualizing it for families, and trying to work with you. So for those of you out there listening, I guess what I would say is don't be afraid to be honest with us when you come to clinic. Let's work on this together and see if we can improve the ways that you get treatment, come up with strategies when it's difficult to try and improve adherence, because ultimately that's going to improve your children's outcome, or your outcome in your kid, depending whether you're the patient or the parent listening.
So this is a really important point. Bring your issues to us and be upfront. We are open to negotiate, to compromise, to work with you with a realistic plan or schedule. So I have done this with a couple of my families, and it has been extremely successful. Even like palpable results. We had decrease in number of admissions and increase in FEV1 just by doing, let's just compromise. Let's do a plan that it's within your expectations and what you can do. So don't be discouraged with the amount of therapy. Negotiate with your family and with your CF team, and come to the visit. I mean, if you don't come, then there's very little we can do. So being here is extremely an extremely important part of making this story a successful story. So, Dr. Kings, thank you so much for your words, and we are going to move to the conclusion of our breakout sessions, and I'll give the microphone to each group to give us a summary of what they've been discussing for the past 15 minutes. So which group would like to share what you have discussed in this past 15 minutes of discussion group? So Kim, I'll give you, you have your